Hi, hello everyone.
Yeah,
Assalamu alaikum.
yeah. Assalamu rahmatullah. Thank you very much for being with us. I know you had a very hard time to catch up with us last 48 hours, and I truly appreciate your effort and caring to be with us in this webinar from Germany. So, Dr. Omid Kermani is very well known and international as well as refractive surgeon in Germany worldwide. And I think you did LASIK upon yourself, monovision, right?
Yes, and I would like to share the perception of the patient. Um,
Yes.
so,
So we have a patient right now with us here.
yeah, we have a patient now. Yeah. So,
Okay.
if you like, I share my screen with you,
Yes,
and
please.
see. So there we are. Um,
Okay.
I have no financial interest in this topic, and I just try to go to the background of my history. And basically, it was that I was really tired of wearing glasses. I had to start reading glasses at age 45, and then I became hyperopic at age 50, and I needed a distance correction as well. And as you can see, I had many different glasses for different tasks that I have to fulfill at work, sports, car driving, under the sunshine, and so on. So I really was feeling frustrated, treating all the time my patients, seeing them very happy, and being unhappy myself. So I had to look for a solution. This was my preoperative refraction. Is hyperopia of plus 1.5, no significant astigmatism, and addition of almost 2 diopter, which is not so bad for my age. Now, in times of Facebook, I posted my case and I asked for advice from my colleagues and experts. And I'm not going into all the different methods that were not proposed and that were not mentioned. Basically, there are two alternatives that we have been discussing, and one was refractive lens exchange, and the other one was laser vision correction. Now, for refractive lens exchange, I personally felt not right at that situation because I have no signs of lens deficiency syndrome at all. My best corrected visual acuity is 1.6 and my lens is clear. So I was afraid of doing this. Also, I've seen patients after refractive lens surgery with vitreous problems. So Dan Reinstein did a significant lot of work with regard to refine monovision in such a way that he shaped the cornea in order to increase the depth of focus by changing the asphericity of the eye. Damien Gattinel did the same thing and published it with a Nidec laser. And I have a little bit of experience with hyperopic treatments as well. Well, there are always these comments which make you a little bit insecure. Usually doctors do not make good patients, but I was really happy to do it, and I was really without any doubt about it. So the difference between micromonovision and laser blended vision, as Dan Reinstein names this kind of procedure, is really about the asphericity of the cornea. By changing the Q value of the eye, you can increase depth of focus. Now, the evolution has given us a shape of the cornea in such a way that our demands in nature can be fulfilled. And the human being, the Homo sapiens, is somewhere in between these two extremes of corneal shapes. The asphericity can be described as a Q value, and usually in a mean eye, it is about minus 0.2. So we have a negative asphericity in the normal eye. If you increase the asphericity, the negative asphericity, you can increase the depth of focus as shown here. And this is being used for blended vision or micromonovision as we use it in hyperopic or presbyopic treatments with LASIK. Now, this was my treatment. I will just go through it just to prove that it's really me I'm talking about. And I'd just like to mention that Carl Schmid did the surgery very well. I have been asked where are you going to have it done. And of course, the best place you can trust is the place where you know the equipment. And who could be a better surgeon than the one that whom you have taught to do the surgery. So I knew exactly what he was doing. We discussed it and it was fine. This treatment itself was not painful at all. It was kind of a psychedelic experience a little bit. I was a little bit dizzy from the medication, but it felt all right. It was not stressful for me at all. Now, this was the treatment plan for the right eye. And please note that the target Q for the distance eye, so the right eye is my distance eye, was not changed. I set the target for minus 0.27 as it was before. The left eye is the reading eye. The effective target was minus 1.75, and the target Q here was minus 0.6, which is recommended to be a good target Q for reading ambitions. So that was the treatment plan, and this is the outcome as you can see it on the pentacam or the tomography, and you can see the pronounced steepening of the cornea of the left side, where the correction was almost 4 diopters. It was 3.25 diopters, and you can see it on the difference maps of the topography. Now, of course, I checked the safety, and at my clinic, we do screen the safety with the biomechanical index. We check the TBI pre-operative. It was not perfect, but it was not that bad. It was, the TBI was, let's say, it was okay, it was acceptable. And since my corneal thickness was fine, and I'm not so young anymore, I'm 59, my cornea has stiffened anyway because of natural sunlight exposure, I thought it's fine to do it. The post-LASIK ectasia TBI, a new test that you can do on eyes that have had LASIK. This is post-operative, showed that I have a very good value with 0 on both eyes. So from this point of view, there was no problem, no safety issue with regard to ectasia. In general, you usually do not have really ectasia problems because you don't ablate the center of the eye. Now, the post-op refraction, it's a little bit overcorrected, both on the right and the left eye, a quarter of a diopter. But if you look at the 10-year refraction history, pre-op my refraction was stable over 10 years. There was an increase of 1 diopter over 10 years to the hyperopia, and post-operatively, there's a little bit of regression, and I hope that it will regress a little bit more, maybe a quarter of a diopter, and I'm just perfect. But right now, I can see 120% distance vision, best corrected, and this is important. I did not lose anything in best corrected visual acuity 1.6 for both eyes. What is most important for me personally in terms of comfort is that my binocular defocus curve with this procedure is full in the pseudo accommodation. My defocus curve is just very much the binocular one, of course, like the one of a young person. And this is tested with uncorrected visual acuity. So with regard to this, in the functional outcome was excellent. Though the higher order aberration, as you can expect in hyperopic LASIK, did increase a little bit, not that much. It was very little with 0.2 prior to the operation, 0.4 after the operation on the right eye, and on the left eye from almost 1.2, a little more increase to 1.3. Interestingly, the left eye was the eye with the higher ablation, but it showed less increase in higher order aberration. Now, how was the post-op recovery? And this is, of course, the topic of this meeting. And I can share my course with you. I had significant temporarily post-op complaints with regard to Sika, to dry eye. And for me personally, the most difficult situation was in the early morning when I woke up. I had difficulties to open the eyes, and this redness, as you can see from this picture on the right side, it very much resembles how my eyes were looking in the beginning when I woke up. computer work was difficult for me, especially more than half an hour or 1 hour. I started to suffer from dry eye. Along with this, not only the sicca, but also in the beginning, the anisometropia at night was disturbing me. I had significant night vision problems, and I had fluctuations of visual acuity, which might be also due to regression a little bit, but that was not so much. I agree to all of you from your previous talks that is, of course, the cause of the sicca, of the dry eye. Now, I have documented the way I have treated my eyes and the way I sense the night vision complaints. And you can see that the time course from the initial time after the operation until 3 months post-operatively, the night vision complaints decreased as the necessity of putting eye drops into my eyes. So there's, I personally think, a correlation between the dryness of the eye and night vision disturbances. In the first 4 to 5 weeks, I also used ointments at night, and now I only use once in a while artificial tears. Otherwise, I'm fine. This is shown in the reflectivity, the pre and post-op, as you can see on the right eye, which has a little hyperopic treatment of 1.5 diopter only. And you see the imaging is good only in the mid-periphery. There is a slight inconsistency of the rings compared to the pre-op situation, and that very much matches the shape of the cornea after hyperopic ablation, which is pronounced on the left eye where the hyperopic ablation was 3.5 diopter. So it's a very simple and effective method to qualify the tear film by just looking at the reflectivity of the placido rings from your topographer. My personal psychotherapy, and I don't want to mention that other eye drops might be working as well for other patients. I tested different eye drops. Basically, I like those drops that have a combination between a lubricants and a bio ingredient that comes from nature that helps to prevent dry out of membranes. So this is found both in the Stan and the Tealos 2. They work very nice for me. I also would like to mention that the supplements, well, it's not really proven, but I believe in this, and for me it worked very fine with the vitamin D and of course the vitamin C, because I think the vitamin C catches the radicals, and if there's an inflammatory process going on, vitamin C maybe is at the stage that I was in, not as invasive as cyclosporine. Omega-3 has been mentioned. I think it's very important. And the ointment at night, I used dexpentanol gels. Now, 6 months post-op, the osmolarity of my tear film is back to normal. I'm absolutely fine. I have no complaints so far. And in conclusion, I may say that my presbyopic custom Q, Femto-LASIK and monovision worked very fine for me. 6 months post-op, I'm absolutely spectacle-free at all times. My tear film decompensates slightly, a little bit accelerated. I don't have dry eyes, but I see that the decompensation is earlier than I was used to it before the operation. So the stress resistance is not as good as before the operation, but I don't think that it's caused to the amount of tear film. I think it's basically due to the shape of the cornea, which gives stress to the tear film. Night vision complaint, they strongly correlate with the tear film stability. I don't have any night vision complaints anymore. I do sense the monovision. Actually, I can play with it, but I have no problems with binocular vision at all by now. After 1 or 2 months, it went just normal for me. I continue with the oral supplements, and I may say that after this personal experience, I wish I had done my LASIK 10 years before. I'd like to thank you very much for your interest in my own case. And sometimes it's nice to be a patient and to see the world from another perspective. You do learn a lot about science when it comes to flesh. Thank you very much.
Thank you very much for this very interesting talk from both perspectives, the doctors as well as the patient perspective. Let me ask you a question. Do you think the ablation profile, because you were hyperopic before LASIK, do you think the ablation profile has something to do with the dry eye after the LASIK? Maybe.
Absolutely, absolutely. I think that's one of the reasons where you can really influence the outcome when you treat the cornea in such a way that the resulting shape is not, let's say, magic to the functionality. High ablations in myopia, let's say more than 6, 7, or 8 diopters, they cause dry eye as much as hyperopic ablations. In hyperopia, of course, the stress resistance is not as good as with myopia because you have the steepening. But with every steepening, you have to get back to the normal shape of the cornea. And this mid-periphery of the cornea is a stress point. And therefore, I personally would not recommend to do hyperopia with the laser procedure for more than +4 diopters.
I see. So do you still use vitamin C so far, 6 months after the procedure?
Yes, but because of Corona.
Okay, so otherwise 6 months or 3 months, do you recommend us to use vitamin C?
Yes.
3 or 6?
I think vitamin C is very helpful in terms of, let's say, naturally cope for the inflammatory aspect. Margaret has talked about cyclosporin, and this is a pretty strong and expensive medication, and vitamin C is easy to get. And I think it has some helpful effect, especially when you start with vitamin C before the operation and continue to take it further on. Also the vitamin D, don't underestimate the role of vitamin D and zinc. Also, all these supplements can support the cause for the patients, and they are cheap and easy, and you can get them everywhere.
Yeah, thank you, because I think you answered one of the questions from the audience. One of the audience asked about the role of diet in treatment of dry eye after refractive surgery. So I think you answered this question clearly by the supplement, multivitamin supplement. Thank you very much for being with us. And now our